Doctors of Reddit, what's the stupidest thing you've had a patient come in for? Story 1. Whilst working as a GP primary care physician, I had a 40-ish-year-old man come in with his wife complaining of electric shocks for the past year. It quickly became apparent these were static shocks caused by his cheap work suit and rubber-soled work shoes. I explained he just needed to change his shoes, and it would stop, but both him and his wife were baffled. They'd never heard of static shocks and couldn't understand why I couldn't treat his condition. Unfortunately, I have no power to change the laws of physics. Story 2. 45-year-old male seen in the ER reported severe burns from boiling water all over his body. On exam, he had no visible burns and had reduced his complaint to a small area on his right index finger, again with zero visible damage. He asked me for hydrocodone several times. It was one of the most obvious drug-seeking behaviors I've seen. Story 3. Not a doctor, but worked in an ER for several years. There was certainly a bit of cynicism that is probably prevalent in many similar settings. Would get people bringing their kids in for hangnail or split ends on their hair? No. Seriously, the inverse, however, was that sometimes you could not be too cynical, as it could have been a big deal in the end. I remember one time a Haitian family came in, and most of the staff would roll their eyes when Haitians came in, because their English was typically terrible, and they would not be able to convey what was wrong. In most cases, it was something like baby has sniffles or constipation, not really emergencies. This particular family brought a teen who claimed his eye hurt. Between the language barrier and the complaint, most people just shrugged and said, yeah, okay, whatever. Turns out the kid got a CT scan that showed worms basically eating his brain. I don't remember the outcome, but the doctors guessed it was poorly cooked. To be honest, not sure if the kid even lived or not. Story 4. I was a volunteer first aider for 10 years. I was on duty at a local judo competition. I was on edge, as there was always at least one serious spinal injury. So I was walking around the mats, waiting for the call to rush in and help save someone, and this woman starts screaming and crying. I ran over as fast as I could, jumping over rows of chairs and ready to help. She was screaming because her baby's first tooth had come through, and she didn't know what to do. She asked me to cut out the rest of the teeth so that she didn't have to deal with teething anymore. Nope. Story 5. My mom took me to the ER once because she thought I had blood poisoning, which is a totally serious condition. What I actually had was fruit punch earlier in the day, and it dripped down my leg. The nurse wiped it off. I was saved. I was 3. My mom was worried. Chill the out. This is the stupidest reason to see a doctor thread. I know it was stupid. That's why I share the story. Story 6. I'm not a doctor, but I religiously go and see my doctor every summer about a mole I have on my back that could have been cancerous when I was younger due to overexposure to the sun, which caused it to grow and go black. I go every summer because I'm not allowed to have it exposed to the sun, yet they will not remove it. If it was so benign, why am I not allowed to tan my body? Worst excuse I got off a dermatologist was if we laser that off. You could have a scar going through your back tattoo ID sooner. Have a scar through a tattoo than melanoma, you idiot. Story 7. So, not a doc kinda, but here's one of my best sea stories. I was an active duty corpsman Navy medic station with the Marines on Okinawa. Late one Saturday night, the Marine on duty woke me asking me to take a look at this private's toe. This kid, fresh out boot camp and not over 21, was drinking during a pre-deployment beach party with his company. Now on the way back to the barracks, he figured that he would get caught by the duty when he signed back into the barracks. So instead of trying to play it cool, he attempted to break into his first floor room, but was so wasted that he fell backwards out of the window after getting it open, and the window fell down on his big toe, smashing it while causing enough pain to have this poor private pass out and fall out the window. The roving duty found him and dragged him to the quarterdeck front desk, and that's where I came in. Now by the time I get down there, the duty officer of fresh first LT, the duty SNCO, a gunnery sergeant are ripping this kid anew. The military does not take kindly to underage drinking, and the fact that someone in his squad was feeding him drinks made this an even bigger shit show. One LT wanted me to take this kid to the clinic and patch him up, but Gunny grabbed me, and the following conversation took place. Gunny, doc, how bad is it? Me, the toe doesn't look broken, just swollen, and the toenail needs to be removed. Gunny, will it kill him? Me, nope. Gunny, stand fast, doc, until we get to the bottom of this. Me, I, Gunny. Private, it hurts. Gunny, you shut the and stop bleeding on my floor. It was at this point that the Marine on duty located the private's NCO. A corporal, this gruff-looking fellow looked a little banged up and hung over, but had impressive military bearing while being chewed out by his superiors. When asked what happened, Gunny, how the do you let one of juniors get drunk? Corporal, sorry, Gunny, by the time I found the private, he was already drunk. Gunny, did you know he was underage? Corporal, yes, Gunny. Gunny, did you find out who was giving him drinks? Corporal, yes, Gunny. And I corrected it. One LT defined corrected it. Corporal, I told him to stop that. And when he got on my face and hit me, I kicked his sir. One LT, give me a name, Corporal. Corporal, it was Corporal, sir. As I was watching this exchange, blood started to drip down the corporal's temple. I interrupted the 1LT and found a 4-inch gash on the corporal's head, hidden under hair, dirt, and sand. 1LT OMG BBQSC UXE freaking me out. Is it going to be okay, Mia? But it's a head injury and not going to mess around with this. How did this happen? Corporal when he hit me with a horseshoe? Me WTF duty, I found. Gunny bring him to me. I sit the corporal down and him try to assist the wound when corporal is brought out. This dude looks like a biker club when him on his dried blood on his lips, black eye, and a nice cut across his eyebrow that the kid was attempting to suture up himself with clothing thread. Gunny loses his, tells me to take all 3 and patch them up, and promises this guy the wrath of God when I'm done with him. After about 20 minutes, I brief the 1LT. Me, sir. Okay, I removed the private's toenail. He'll be fine, but he needs to come back Monday morning for follow-up. No prolonged standing for more than 10 minutes, and no point for 2 weeks. After that, he is yours. Corporal needs to go to the hospital. I do not mess around with head injuries. He needs an x-ray to rule out swelling, and I do not have the proper tools to patch that wound. Needs to go to the ER. I will not touch that job he did on his face, and if he hit a dude with a horseshoe and then got his kicked, I will not rule out other injuries. He needs a proper exam. 1LT good to go. Gunny, how long can the private mop? Me mop. Gunny, can I have this piece of mop up his blood off my quarterdeck? Me, yes, but for no longer than 10 minutes. Gunny, good to go. Private, get a mop and get your off my floor. We're going to have fun tonight, me, okay, and going back to bed. Thank you for the gold. I work in a burn unit, had another hospital fly. Yes, fly, as in 50,000 helicopter ride. A patient over. Patient ended up having what looked like a bad tan on a small portion of their body. There were a couple little blisters on their leg, and they wouldn't stop screaming for pain medication, and claiming that they were in 12-10 pain. Fairly sure that sending ER was just trying to dump them on us. Edit, everyone can stop telling me how super serious and special their sunburns were. You still don't need a helicopter. Story 8, okay, my brother is the doctor, but this story is unreal. He had a guy come in several times with a urinary tract infection. A dude. So that's weird. The first couple of times they were like, okay, that's strange, hey Ray, some medicine. Dude kept coming back like 6 times with a UTI. They ask him everything they legally can, like why does a guy keep getting these, trying to narrow the cause down. Finally, they ask him what he does for a living because nothing he answered was out of the ordinary. Brace yourselves. Guy works at high-end gay club where each night he attaches his Johnson to a catheter and serves wine from it. My brother isn't a judgmental guy at all, and said the guy seemed to do quite well for himself, but he was like, at what cost? So yeah, edit 1. It's neat some of you don't believe me too. This was in inner city Detroit where my brother was finishing his 3rd year in residency. I don't want to give too much information since I don't know any of the laws about privacy. 3. I don't know exactly how it worked. I do tech sales. The end result was that a mixture of wine and probably some pee came out of the tip. Story 9, not a human experience, but we had a pup that was about 7 months old admitted for essentially an evisceration. Now, while the thought of a small puppy having a giant hole in its stomach and all of the organs spilling out is terrifying, it was completely preventable. After the spay, the owners were instructed to leave the cone of shame on the puppy at all times if she was not being directly supervised. Well, they didn't, claiming that it looked like it was hurting her, so they took it off and left the house. The puppy promptly licked open her stitches, and from there, it got kind of gruesome. The even more stupid part is that the owners threatened to sue us because it was our fault that they ignored medical instructions and thusly had to come back in and pay over $1,000 to have their puppy's life saved. People are dumb. Edit, the puppy survived, and I see her regularly at our clinic. The stitches were dissolvable, but they don't instantly do so. Hence the cone. We did follow procedure by stating the expenses beforehand to determine if the owners would have to surrender. Luckily, they were financially stable enough to afford the immediate surgery. Had they surrendered, I'm confident that the puppy would have become mine. Thank for the responses. Story 10. There was this young kid who was crying and told me his cousin might just be pregnant. The kid admitted that they had too much soda to drink and one thing lead to another, and they eventually made eye contact for a full 10 seconds. The kid thought that this impregnated his cousin. I assured him that 10 seconds is not long enough to impregnate someone. As he left the hospital, I realized that the whole thing was so stupid as I remembered that his cousin was also a boy. Story 11. Not a doctor. Dated one who told me she had a patient who came in with his wife that every time they had, his mouth went numb for a little bit. It confused the out of her, so she had them both walk through their routine. It seems his wife was using a spermicidal film just before they started every time, and he was going down on her. Story 12. The stupidest thing I've been to the doctor for. I took my young son in because he had a very regular rash on his lower back. It wasn't until I was in the doctor's office that I noticed that it had exactly the same pattern as the inlet cover on our jacuzzi, which he had just been bathing in. Story 13. Had a patient come into the ER with very mild abdominal pain. I asked when it started, and he said right now. He didn't have a coherent answer when I asked how he knew to come to the ER if his pain just started now. I still don't understand what brought him in. It was an all-around odd encounter, and he left pretty quickly. We didn't do anything for him. On a side note, he complained about the wait. He waited 12 minutes after he checked in before I saw him. I checked the records, I'm not exaggerating. Literally 12 minutes. Story 14, not a doctor, was a medical assistant. Not the most stupid thing ever, but we had several women come in to get tested for a UTI because they were peeing blood. Some of the first questions we ask are you feeling any pain during urination, and have you recently had beets? 910 these women didn't have a UTI and remembered eating beets. P.S. Sometimes eating beets will turn your pee and or poo red, but it's not the color of blood. I also knew a lot of pharmacy students, and they were also told to ask the patient to demonstrate how they were applying or taking medication if the patient said it wasn't working. The anecdote in their textbook was about a teenager who became pregnant, even though she insisted she used contraceptive jelly. She was spreading it on her toast. And that reminds me of another time. This woman came in and said the syringe for her baby's liquid medicine wasn't working, so we asked her to demonstrate what she was doing for us. She sticks in the bottle, turns it upside down, and says, "See, nothing, you have to pull the plunger, lady." Story 15, not a doctor, but I create accounts for the doctors and nurses to use in the ER. I work right next to the ambulance bay, and I see all sorts of random. Some chief complaints I've witnessed being hungry, faking seizures, terrible attempts, too sleepy, a paper cut, no complaints, slow walking, obesity, denial, no money, is too smelly, lose tooth, too much earwax, an entire family checking in for a possible cold, a pimple, too hot outside, too cold outside, too bright outside, too dark outside, too noisy outside, evading police brutality, eventually arrested during visit, forgot where Husha lived, a legit concern but stupid, as a guy came in with a pitchfork, impaled on his thigh. He and a friend was jousting on skateboards. My friend is a doc AR the ER. She told me about a guy who came in and was blue all over his body. He was freaking out and trashing the place in pure panic. Turned out he had bought new blue bed sheets, and they colored him blue. Story 16, our nurse. We have a frequenter visitor every time he gets out of jail. The last week he signed in for being cold, having a nose itch after snorting cocaine, needing to. It should be mentioned that he signs in and refuses to see a doctor or have vitals taken or any care. It's also an in a college town. So every now and again we get the kid that comes by ambulance for anxiety after smoking a huge blunt for the first time. We get our influx of urgent care complaints. Once a very large woman called an ambulance for chest pain, but really just needed help reaching the TV remote that got lodged in her fupa. Story 17, vaginal discharge. Did the pelvic exam, white clearish discharge. I looked at the sample under the microscope, see swimming around. Asked her when last she had. She says last night, which is when the symptoms started. Sigh. Story 18, I'm not a doctor, but I once called 112 European version of 911 because I overdosed on space cake. Now I live in the Netherlands, so it's legal to have up to 5 grams of weed. I had never been high before, and I thought, 2 slices can't probably do too much harm. The thing was, the coffee shop that I bought it from put 1 gram of weed in their space cake instead of the usual 0.5 grams. The officer was like, "Dude, it's just space cake. You can't die from it. Just enjoy yourself." But I didn't know if I could trust anyone because everything just felt like it was happening in another dimension. It's very difficult to explain what that trip was like. It mainly felt like the time was repeating itself over and over, like if I walked down the stairs. It felt like I walked down the stairs 5 or 6 times in a row. Story 19, my first thought was these stories shouldn't be told. We want people to feel comfortable and safe with approaching a doctor if they're worried about their health. Then I read these stories. Good God, people are dumb. Story 20A, female patient comes to the ER saying that she has an abscess. Turns out it was just a little pimple on the nose. Another patient comes to the ER during a very busy shift. I take her in, ask her why she is consulting. Turns out her house burned out 2 weeks ago, and her prescriptions burnt with the house. She didn't thought about getting an appointment with her primary care physician. Just came to the ER. We sent both patients home explaining what an emergency is and with an appointment to a general doctor. Story 21, only work for pathology as a science nurse, not a registered nurse. Foreigners often thought I was a doctor. After a blood test, they would say, "Thank you, doctor." Use the actual doctor's off for good reason. One day a guy came in and I asked for his referral. He said he wasn't here for a blood test, but wanted to tell me he thinks he is pregnant. His wife told him to find a female doctor me during his pregnancy. I try my hardest not to laugh. He was so serious. He had broken English, but he explained all his symptoms and showed me his swollen belly. I told him I wasn't a doctor and took him down the hall to an actual doctor. The doctor let me stay while he explained to the patient he wasn't pregnant. The patient was convinced he was and wouldn't leave until they did an ultrasound, which we didn't do at the medical center, and he would need a referral to have one done. So the doctor had him do on-the-spot urine test, which showed negative. The patient was still convinced he was pregnant. The doctor asked if he was ever female. He said no, I think, but I'm not 100. The doctor ended up writing him a referral to the woman's hospital to have an ultrasound. Story 22 had someone come to my ER last night because they had a splinter, a small one that my 3-year-old would have taken out herself. Meanwhile, U3X's arm got to deal with a 19-year-old patient who presented with lower abdominal pain, worse than she had ever felt before. We ruled out pregnancy and ovarian cysts. CT scan showed she was literally full of so constipated. It was a long night. Story 23 had someone come into hospital because they got their arm stuck in a shredder. I mean, it's a legit reason to go to hospital, but kind of stupid to be in that situation to begin with. I don't know much about shredding, but even my instinct tells me not to put fleshy appendages in the dangerous bits. Story 24 does calling EMS so you can get a ride to the hospital to see your other homeless friend who is in their count. I'm not kidding, this person said. She had a syncopal episode, then as soon as she got to the hospital, hopped off the stretcher and said she was fine after the doctor talked to her and went to another room. Story 25, not a doctor, but once I went to the doctor because I felt a bump at the center of the back of my head. Doctor told me that's where the spine connects to the skull. Whoops. Story 26, I'm no doctor, but my middle-aged neighbor saw me in the hallway, and he looked awful, really sweaty and lethargic. Obviously, I was concerned and asked if he was okay. He said he was off to the doctor's to get his, I quote his exact words, fragile bumhole checked out as he farted so hard he thought he tore it right up. I wished him luck and watched him shuffle away. Edit, saw my neighbor this morning and had it in mind to knock on his door to find out if he was okay. Had I not seen him by the end of the week, he looked even paler and more clammy than before. Expecting to hear some positive outcome, he told me in his yet again thick London accent that some young student nurse tart ordered him to drop his pants so she could finger his to see what all the calamity was about. He told her to off and came straight back home to suffer alone what looks like could be a very serious problem. He can barely walk, just shuffles, which he never did before, and am now convinced he really has torn up his, told him to knock my door if he needed me to pick up any medication for him, only for him to mumble, I should mind my own business and he can handle his own. I tried. Story 27, am a little late to the party here, so I'm not sure if anyone will see this, but anyway, I'm not in the medical field at all. But my wife is a nurse practitioner who regularly works with youth in a local juvenile detention facility where underage suspects criminals are sent to await trial and serve their sentences. One young lady in custody was pregnant and didn't know who the father of her expected child was, but she told my wife not to worry about it. Apparently, she would be able to deduce the father's identity based on the child's accent after birth. Yup. Story 28, fresh graduate from medical school here. I did my internship in a public hospital in India and have had my share of experiences with people from remote, rural areas. Once we had a lady brought in for attempted suicide. The pills she took, stilbestrol tablets, meant for inducing ovulation in their cow. She figured if it's medicine for cows, it must be toxic in humans and down a few. Another time we had a mute patient, also bedridden since a few years, brought in by his brother following trauma. We suspected a pneumothorax, which is when air gets into the lining of the lung and can dangerously compress the lung tissue and compromise air entry. Asked the brother to get an x-ray done. When he brings in the film, it's suggestive of COPD, which does not correlate with the clinical findings at all. Only after several rounds of questioning did the brother pipe in that he had gone and gotten his own x-ray taken instead of the patient's. Families who forget that the patient is HIV positive or has active TB. Women who genuinely have no idea how they got pregnant. New mothers who push their newborns to sepsis by feeding them unpasteurized cow's milk right out of the packets. The list is long. It's more sad than funny, and the huge inflow of people in public hospitals don't give us the luxury of educating the people who need it the most. Edit added some words to remove confusion. Story 29, ER nurse here. I have a million of these. This is my favorite in recent history. A woman checked her 9-year-old son into the ER because he was upset he didn't win an award during an academic award ceremony at school. She wanted someone to talk to him or something. I can't deal with him. She basically wanted us to parent her child for her because she didn't want to be bothered. Story 30, when I was 18, I was the idiot. ID found a big, hairy spider in my apartment, tried to squash it, but it got away. I couldn't find it again, and also didn't sleep well for the next few nights because I was paranoid about the same spider lurking in the dark, somewhere in my crappy apartment. Then I woke up with what looked like a spider bite. So I start Googling spider pics, and become convinced that the spider I saw was a brown recluse. And now I'm going to die. As I'm reading about brown recluse horror stories, I'm getting a headache, feeling hot flashes, and start feeling nauseous. I actually called 911 and I cringe so hard thinking about it now. But they took me to the ER where I waited for 14 hours to be seen, and by that time, slept off my brown recluse bite symptoms to the point that I couldn't even remember where the bite was supposed to be. The ironic thing is that now I work in healthcare, and when people like this come into the ER on my shift, I'm actually happy to have an easy patient to deal with, all things considered. Story 31, I was a medical student at the time, so I don't know if he was screwing with me or not, but I had to maintain a non-judgmental attitude because my preceptor was right there. A guy, obviously male, in his late 50s came in and complained that he had never had a pap smear and that he was afraid of getting cervical cancer. A few things went off in my head. 1, maybe he means prostate exam. 2, maybe he wants a colonoscopy. 3, maybe he actually does have female genitalia. 4, maybe he's just severely and utterly confused and undereducated. It was 4. Story 32, I had a patient present to the emergency room with a chief complaint of passing out. He reported that he would just pass out in the evening. I asked him if he ever fell and hurt himself. He said no, that he is in bed when it happens. I asked him how frequently this happens. He said every night. Story 33, ran to the dermatologist because of a spot on my, but that I thought might be cancerous. Doc looked me in the eye and said, Phil 330, that's a pimple. Story 34, I was the idiot. Went there for a fever. The fever was bad. I was delirious and spent 8 hours in the waiting room, Canadian free healthcare, singing to myself, "We need a Quickie Mart." I do, the whole freaking time. Doctor asked me if I had at least taken an Advil pill for that. I answered no. He rolled his eyes, gave me the pills, took a swab sample to make sure it wasn't viral. It wasn't, and sent me home. The pills worked, of course, felt pretty stupid. Story 35, I was a little idiot. After 3 hours of fooling around with my GF at the time without finishing, I started to feel a pain slowly growing in my testicles, and eventually the pain was so much I ended up going to the ER. I thought it was testicular torsion. I seriously thought I was going to lose my bag of goodies. When the ultrasound technician took a look, turned out it was just the worst case of blue any of them had ever seen. If you're out there, I'm sorry you had ultrasound, my ma'am. Story 36, had a young man come into my ER scribe. Not doctor one day complaining of dental pain. His wisdom teeth were coming in, and turns out he tried to cut them out with a steak knife. He was confused as to why this hadn't made his pain better. When I asked why he hadn't gone to his dentist to have them removed, he said something along the lines of, "I'm really scared of needles, because a steak knife is less imposing than a needle." Story 37, once a patient came into the ED because she had tried to wax her underarms in the wax set. She couldn't get it off using hot water or soap, so thought sitting in an ED waiting room for 3 hours was a good idea. I didn't look after her, so cannot say if or how my colleague got the wax off, but everyone in the department heard about the triage note by the end of the shift. Story 38, not a doctor, but I was a corpsman in the Navy. I had a Marine come in because he swallowed a rock. Why, I asked, puzzled, would you swallow a rock? I was hungry, Marines, man. A friend of mine working as a landscaper wound up in the ER after he reached into the moving blades of the massive mower to try to grab a stuck tuft of grass. Cut the tips off all 3 of his middle fingers in a line down to his middle finger first knuckle. Hilariously, it was his last day on the job after years of somehow escaping injury. Edit, I should add that he managed to do this while straining to reach around to the blades whilst holding in the clutch, which kept them spinning. Story 39, one evening in emergency, I had a woman come in because she had a low blood sugar yesterday, and she was totally fine now. She was having unexplained episodes of low blood sugars and was being very appropriately worked up by her family doctor as an outpatient. But she had come to the hospital for her husband's appointment and decided she would just drop into emergency to see if we could do anything else for her episode that had completely resolved. Frustratingly, it was a very slow evening, and she was seen within an hour. Story 40, a friend of mine who was in school to become a nurse told me a story of why they have to be explicitly clear when explaining how a patient should administer their medication. When a woman who came in for an ear infection was given a liquid capsule for ingestion, she came back in with no results. Turns out she was puncturing the capsule and squirting in her ear. Another story was a woman who had recently been diagnosed with diabetes and needed to give herself injections. The doctor demonstrated how to do the injection by using an orange and injecting the needle into it. Turns out the women had been injecting oranges with insulin and eating it. Story 41, I once had a patient with a cancer diagnosis, completely depressed about not being able to see their family anymore. I was confused because I had spoken with this individual's spouse, an extended family, who seemed supportive. There wasn't any indication of family problems, etc. It turns out that this individual thought genetic and family history had meant something similar to contagious, leading them to the conclusion that one should stay away from loved ones lest it be spread through the family. That was one clarification I was so happy to give. Story 42, not a doctor, but I was a nurse's assistant and a kitchen staff member came in and said, "Help, I ate raw corn." Apparently the cook had convinced him that eating raw corn was poisonous or something. I had a good laugh about it. Story 43, a woman came in for a baby check with her 6-month-old, and she had what looked like chocolate milk in the baby's bottle. So he started explaining to her, as kindly as he could, that she shouldn't be giving her baby chocolate milk, at which point she interrupts him and says, "Oh, that isn't chocolate milk, it's coffee, he just loves it." Story 44, we had an ambulance calling over the radio for a foreign body in left eye. We started mobilizing, called the ophthalmologist on call. We're ready for shrapnel, a big tree branch, something big. We get a woman with an eyelash in her inner eyelid. She got an ambulance and private ER for an eyelash. Our only consolation was thinking the big bill she probably got. Story 45, everyone's telling bad patient stories. How about a bad doctor? I work in a major metropolitan level 1 trauma center, ED. Patient arrives via ground EMS from an urgent care center complaining of having a fast heart rate. Can certainly be a legit complaint. The paperwork the urgent care center staffed by a physician states that the patient presented to them in SVT, supraventricular tachycardia, a not so nice and very fast heart rhythm relatively common in young folks, and subsequently tried 3 attempts at treating it with adenosine, a medicine that temporarily stops your heart in hopes that when it restarts it's back in a normal rhythm. A chemical version of the defibrillator. This is fairly common practice, but is always a big deal and requires the presence of the physician, several nurses, a tech, and a crash cart placed outside the room in case things get ugly, which they can. The physician was unsuccessful at converting the patient back to a normal rhythm. So we take a look at the EKG performed at the facility, and my jaw drops. The patient was not in SVT. They had never been in SVT. She was in a normal rhythm, albeit fast, 125 BPM. The problem was that apparently she was moving or shaking while they were taking it, and this created a lot of artifact, which made the machine interpret the rhythm as SVT, which was printed at the top. My point is, the doctor never actually read the EKG. Or, more scarily, doesn't know how to read an EKG and is relying solely on the wisdom of the machine, which is abysmal. They then administered a heart-stopping drug 3 times in a non-hospital setting, knowing full well that if she went into cardiac arrest, there's almost nothing they could have done about it beyond CPR defibrillator. By far the most stupid transfer I've ever seen, closely followed by the transfer from another urgent care facility for a through puncture injury to the hand, which turned out to be a splinter 1 centimeter penetrating through the very edge of the web space between the index and thumb. Such a waste. Story 46, multiple people with dental problems. I know nothing about dentistry. We get no training in dentistry. I can give you paracetamol, maybe codeine if I'm feeling nice, and direct you to the nearest phone so you can contact a dentist. Patients asking if their appendages are large enough to satisfy women. Very difficult to deal with when you only nurses available to chaperone are young and reasonably attractive women. Because great deals of embarrassment, and my least favorite, people who come into hospital who have had diarrhea for less than 24 hours, no other symptoms, still managing to keep water down, no evidence of dehydration. Had people come in with symptoms for only 3 hours expecting treatment. Frustrates me no end, puts our staff at risk, which means a minimum of 48 hours mandatory sick leave, and there's not a great deal I'm going to do about it besides tell them to drink some water. Story 47, my mom's an ICU nurse, and they once got a guy who had thrown a TV out of a 3rd floor window because his football team had lost. Dude was so drunk he forgot to let go of the TV, so he fell out as well. This was before flat screen times. Story 48, not really a patient story, but still funny. My dad is a firefighter, and they received a call from a distressed woman who locked herself in her car. Apparently, she refused to let the 911 dispatcher help her. She had to have the fire department come. They get there, and she's freaking out. She left the keys on the floor of her garage, closed the door of her car, and I guess bumped into the door lock button. She didn't realize you could hit the same button and let yourself out of your car. Maybe she was panicked and not thinking straight. I don't know. So my dad is just talking to this lady through her window, telling her to hit the button. She does. It gets out so dramatically, like full-on heavy breathing, clutching her chest kind of panic. She was so thankful that they came and rescued her. Story 49, not a doctor, but people have literally come to me with complaints that they're stupid and then asking me to help them find doctors to consult about it. Edited. Story 50, not a doctor, was an athletic trainer for a college football team at the time of this incident, had an underage player who had been out on a Friday night and got wasted at a party. The cops showed up and everyone scattered. He ran and thought there was a cop chasing him. Witnesses say he was not being chased. He lost his shoes while running and then stepped on a hot manhole cover while walking home. He ended up with second-degree burns and an infection because he did nothing over the weekend to take care of it.